Hello everyone, this is Dr. RITIKA Mani, Assistant Professor at Dolphin PG Institute of Biomedical Natural Sciences from the Department of Physiotherapy. Our today's topic is about ultrasound therapy. Ultrasound is a mechanical vibration at any frequency above the audible sound. As you all know that the sound is defined as the periodic mechanical vibration of an elastic medium such as air. Sound requires a medium for its transmission and cannot cross a vacuum. So, ultrasound refers to the mechanical vibrations which are essentially the same as the sound waves but of the higher frequency. Such waves are beyond the range of human hearing and can therefore be called ultrasonic. This is the application of ultra frequency waves, ranges from 1 to 3 MHz to tissues in order to promote healing and reduce the pain and swelling. Therapeutic US is used in physiotherapy ranges from 0.5 to 5 MHz, but most US machines are set at 1 MHz or 3 MHz frequency. They are mainly classified as deep heating modality. Vibration merges with sound at frequencies around 20 Hz, and the vibration below this frequency is called infrasonic or infrasound. The audible sound ranges from 20 to 20,000 Hz. Ultrasound is greater than 20,000 Hz. If it is infrasound, less than 20 Hz, and therapeutic ultrasound is 0.5 to 5 or 1 to 3 MHz. Now, as these are the sonic waves and the series of the mechanical compressions and rarefactions are in the direction of the travel of the wave, hence they are called longitudinal waves. They can occur in solid, liquids and gases and are due to the regular compression and separation of the molecule. This is the main reason why there is the movement of the molecules. Now, the passage of these waves of the compression through matter is invisible because it is the molecules that vibrate about their average position as a result of these sonic waves. It is the energy that travels and not the matter. Now, the production of ultrasound is mainly depends upon the effects, that is the piezoelectric effects. It can be reverse piezo also. Piezoelectric effect is that the production of the small electromotive force, that is EMF, across the certain substances on being subjected to the external pressure. Such substances are known as the piezoelectric substances. So, the inverse piezoelectric effect is used in the production of ultrasonic sound waves. In reverse, the production of the mechanical waves or the vibration is due to the application of EMF. For example, the piezoelectric materials are there, that is the quartz, the barium titanate and the lead zirconate titanate PZT, and the application of the high frequency alternating current to the PZT crystal of the transducer transmits the electric energy into the vibratory sound. That is the mainly used in the ultrasound therapy. The reverse piezoelectric effect is used. Many types of crystals can be used, but the most favored are which occurs naturally, and some synthetic ceramic materials such as barium, titanate and PZT is used. These crystals reforms when subjected to a varying potential difference, that is called as piezoelectric effect. In order to apply the electrical charges, the metal electrode must be fixed to the crystal. If a suitable metal plate is fixed to one surface of the crystal while the opposite surface is in the air, then almost all the vibrational energy is transmitted from the crystal to the plate and hence to any solid or liquid to which it is applied. Now, this is the diagrammatic representation, the piezoelectric effect. Here the sound vibrations are converting into the electrical signal with the help of the piezoelectric ceramic. And in the reverse effect, the electric signal, this is the electrical signal, and they are converting into sound vibrations with the help of the ceramics. So here in the ultrasound we use the reverse effect, mainly used. Now, the properties of the ultrasounds are there, like as we all know that attenuation process is there. The loss of the energy from the ultrasonic beam in the tissue. This is called attenuation and depends upon the both absorption and scattering process, that is the reflection rarefaction. So absorption accounts for about 60 to 80% of the energy lost for the beam, and the scattered energy may also be absorbed other than in the region to which the ultrasound beam is applied. The scattering is called by the reflection and rarefaction, which occurs at interface through the tissue. This is particularly apparent where there is a large difference in acoustic impedance. Next one is the half wave distance. This is 4 cm for 1 MHz and 2 cm for 3 MHz. This is the depth of the tissue at which the US intensity is half its initial intensity. So the absorption of the sonic energy is greater in the tissue with largest amount of the structural protein and lowest water content. Blood is having least protein, so least absorption is there. Bone is having the greatest protein content, so it has the greatest absorption. For depth, let us talk about the depth of penetration. This is 1 MHz for the deeper tissues at the depth of 3 to 5 cm, and 3 MHz is for the superficial tissue at the depth of 1 to 2 cm. The depth of the penetration is inversely proportional to the frequency. So if there is increase in the frequency, the depth of the penetration is less. Now let us talk about the near field and the far field. As we have discussed it, that in ultrasound, that waves formed from the different parts travel in the different distances, causes interference between the adjacent points. You can see in the diagram, this is the near field and this is the far field. So some waves can cancel out their reinforces, so that the net result is very irregular pattern of the sonic waves in the region close to the transducer phase. This is called as the Fresnel zone, or also called as the near field. The near field is the convergent region, right? And the far field is also known as the Fraunhofer zone, that is the divergent region. The sonic field is spread out there somewhat and becomes much more regular because of the different path length from point to the transducer. The length of the Fresnel zone is R2 by pi, where R is the radius of the transducer. Therapeutic US utilizes the near field. Mainly near field is used. The length of the near field is depend directly on the square of the radius, as I have discussed, and the length of the Fresnel is R square by pi. The frequency of US and the radius of transducer needs to be considered for the tissue depth above 6.5 centimeter. As for the practical uses, we are using near field, and the relatively more energy and average is carried in the central part of the cross section of the beam. The irregularities of the near field can be ignored, as to some extent, by the continuous movement of the treatment head during the therapy. Now the coupling media. As for applying ultrasound, we should use coupling media for this, as it has a very great importance also. Ultrasound waves are not transmitted by air, thus some couplant should be there for the transmission, as unfortunately no couplant affords perfect transmission and only a percentage of the original intensity is transmitted to the patient. Like if you are using Aquazin gel, it transmits 72.6% of the beam. If you are using glycerol, then it transmits 67%, distilled water 59%, petroleum jelly 0%, and air 0%. Now the characteristic of the coupling media is that it should be a caustic impedance similar to tissue, should has high transmissivity for the US, low susceptibility to the bubble formation. Like if there is bubble formation, it can be harmful for the tissue. Chemically inactive in nature, it should be there. Hypoallergic character is present. High viscosity, cheap, and relatively sterility of the tissue should be there. Now if you are using the US beam, then we use the two modes for the beam, like we use continuous and pulse mode. So its mode type can be continuous and pulse type. Pulse mark space is always in ratio 1:1, 1:2 and 1:4. Continuous mode supplies the continuous radiation. Power is the amount of the acoustic energy per unit time. Intensity is the power per unit. All these remains are in the ultrasound modality. Power per unit area of the ultrasound sound held is the intensity, and the space average intensity and the time average space average intensity is pulse. Frequency is the number of the compression rarefaction cycles per unit of the time. The intensity is always in watt per centimeter square, and the frequency is in hertz. Effective radiation area ERA is the area of the transducer from which the US energy radiates. The transducer is the head by which there is a transmission of radiation. Duty cycle is the proportion of the total treatment time the ultrasound was on. Now, next is the depth of the penetration. The majority of the ultrasound generator used in the physiotherapy are set at the frequency of 1 megahertz or 3. The depth is like that. One is the ultrasound beam has the depth of penetration of 3 to 5, as we have discussed in the previous slides also for the deeper tissues. 3 megahertz is with the depth of penetration of 1 to 2 centimeter, and this is absorbed in the superficial tissue. Next is the treatment protocol. What should be there before applying the ultrasound therapy? There should be a preparation of machine, preparation of patient, set up the treatment protocol, termination of the treatment, and the documentation of the subject, the patient. This is the transducer, also called as the head. It is a device that converts the one form of energy into another. Here from this type, from this transducer, the energy is transmitted to the skin or body. The piezoelectric crystal is a transducer that converts the electrical energy into sound energy and vice versa. 1 centimeter to 10 centimeter square, 5 centimeter square most commonly used. This is the circumference. ERA, effective radiation area, as we all know that the area of the face plate, that is the crystal size, which is smaller than the sound head. Now, next one, this is your therapeutic ultrasound unit. This is the machine and this is the transducer head. Here we go with the intensity setup, 1 megahertz, 3 megahertz frequency. We can set it in the continuous or pulse mode with these modes. Protocols include the preparation of the machine, positioning of the patient should be there, be assured of the functionality, all the accessories, closer, the aquasonic gel is used, cotton wool can be used, inform your patient about the treatment, water in a ball. If you are using the underwater ultrasonic therapy, then we use water in a bowl. Expose the treatment part, remove the metals, you can remove hair if necessary, wash with swab, clean the part. Previously go with the assessment of the treatment part, right? Inspect the part, check for the intact sensitivity, sensation, right? Cooperation should be there with the patient and family members. Set up the treatment, secure the patient's comfort and stability, plug supply on, select the program accordingly with the condition, with respect to the condition, like if it is acute or chronic, then you can set it in the continuous or pulse mode. Apply coupling media like gel, then ensure the transducer is in contact with the coupling media on the skin. The transducer, the head should be in contact, it should not be away from the treatment, from the skin. Then start now with the button and keep asking how the patient feels. Heating in the tissue is due to the ultrasound. Sometimes the important factor for heating in the tissue is due to the ultrasound and the rate of tissue heating, which is influenced both by the blood flow, which constantly carried the heat away, and by the heat conduction. In the highly vascular tissue such as the muscle, it is likely that the heat would be rapidly dissipated, preventing the large temperature arises on that area. That is, if you are using it on hand or ankle, Less vascular tissue such as dense connective tissues in the form of the tendon or ligament may experiences a relatively greater temperature rise. So moving the transducer head during the treatment is very important. It should be in the regular ways, like in the circular way or the figure of 8, to smooth out the irregularities of the near field. It should be in the with respect to the contact with the skin. So that's all about the protocol. Next we will discuss in the next slides of the ultrasonic therapy. Thank you so much.